when you get chronic sinusitis, whether it's bacterial or viral or fungal or whatever, causes the lining to get inflamed. Then the tiny holes in your nose and your face get more inflamed and things back up and can go into your sinuses and basically wreak havoc from there.
Thinking about that, I may be confused. Sinusitis is an infection, right? You just said it's one of those three types. It's viral, bacterial, or fungal. Yes?
Yes, so I guess sinusitis as a term alone would just mean inflammation of the sinuses. So what can cause sinusitis? It could be allergies causing inflammation, but if you're going to be more of a infectious sinusitis, which is what we typically think of, like a sinus infection, it would either come from a virus or from bacterial infection or from a fungus. It can be precipitated by something like allergies. So if you get inflamed, more crap can get stuck in there and then it can get more infected. So,
But I would have thought that an infection goes away, right? So how do I get a chronic infection?
that's a good call. So, how do you get a chronic infection? The definition of chronic infection, I guess, would be something that lasts for more than 12 weeks. So, if the stuffy nose, the pressure in your face, your teeth pain, all that just isn't going away for over 12 weeks, then in the ENT world, we put that on as a chronic infection. In your nose, there's only a limited amount of space. So sometimes if it doesn't get treated, things just get so inflamed that everything backs up. And so once it gets backed up, all the medicine in the world can't get it out. So it gets stuck up there. And that's when you hear about the stuff that keeps coming back over and over and need more treatment than just your average neti-pot for the neti-SNOT or an antibiotic.
Or if you get a Mike and Ike stuck up there.
Yes, we do see crazy stuff like that.
We'll get to that. Yeah. Well, yeah, like who gets this? Are there risk factors that some folks can have that might make them more apt to getting chronic sinusitis?
Absolutely. I'd say one, people with allergic rhinitis or different allergies are just more prone because they have more inflammation in there. Two, people with anatomic defects of their nose, if it's real crooked, if they got in a fight, or if they have a deviated septum, which means that one side of the nose is smaller than the other and it's kind of blocking the average flow of the mucus in the air. Anyone can get it, though. You can get it like any other bacteria, but some people are going to get affected more just by their anatomy and their underlying conditions.
How do you diagnose it? Do you have to do like a scan of your head? Do you have to like take a culture of the stuff in your head holes?
If someone comes in with symptoms such as a stuffy nose, if they're wearing a breathe right strip and look super cool, they say that they have pressure in their face, teeth pain, headaches. We go on to a physical exam. When you look in their nose, then you see if there's any swelling of the mucosal lining, if there's any pus, if you see any polyps. Then we have a nasal endoscopy, which is a camera. Basically, there's two options. There's a rigid one that's like a little metal stick, or another one that's a long rubber thing. So it's like a rubber hose up your nose, we like to say. And can go in each nostril, look around, look for inflammation, see if anything's blocked up there, if there's any pus or polyps, if it looks kind of discolored up there, if there's just no space to get through with the camera and people are completely clogged. We definitely do take swabs at times and see if there's a bacteria growing. I've been known to swab a lot to kind of just figure out exactly what bacteria it is, because then it gives you a list. It's this bacteria, these are what treats it, and you give it and they can get better. And then there's CT scans of the sinus, which we use all the time to see if it's just in the nose or if it goes farther, is actually filling the sinus cavities in the head.
Got it. How do you treat it?
Depends. So let's say you come in with acute sinusitis. Most of the time, if it's only been for a few days, we can assume that it's viral because that's the most common reason people come in. If it goes on for about a week or 10 days and it looks like there's pus in there, and the first round is definitely an antibiotic. And most of the time some nasal steroid like a Flonase, or we love neti-pots. I think, rinsing the nose out is the best. Dilution is the answer to everything, as they say. Just rinse it all out. If it's not up there, it can't be infected.
Did you on purpose choose not to rhyme right there?
I did. I had to hold it in. It's the solution to pollution. And if people turn into chronic sinusitis, where we can't really get it with maximal medical therapy of steroids orally and nasally, antibiotics, rinses, treated all their allergies, see sinusitis on their CT scan, that's when we turn to more procedural or surgical options.
I love that you brought up the endoscopy, the camera. If you could go through kind of what that procedure looks like, what patients feel, if they're awake, how quick do you do it on the same day that you're doing physical exams?
Yes, it's a common misconception that it's a whole procedure separate from everything else we do. In the ENT armamentarium, definitely the scope is part of our physical exam. So what do we have that your average family medicine doctor, ER doctor, or primary care can't do? Like they can look in your nose as well as I can, right? But I have the tools to look a little bit farther. So that's how we do it with a nasal endoscopy. So if you're coming in for a stuffy nose to an ENT, chances are you're going to get something stuck up there. So be prepared.
Is it uncomfortable?
I'm not going to say it's like what you want to do on a Friday night, but it's not painful. You're not going to go home with any lasting side effects or anything like that. We usually spray the nose first with a combination of Afrin, which opens it up a little bit in your nose to give it more room, and some lidocaine that numbs it. So most of the time, people's biggest complaint is that the nasal spray tastes bad and it makes their throat a little numb. We look in the nose about 7 to 10 seconds each side most of the time, and then everyone's like, that's it? I was expecting it to be something awful, but it's not. We do it all the time.
So it's like different than when you have to go get the colonoscopy. You don't have to give somebody a prep that they got to do 24 hours ahead of time
No,
and
it's not that fun. No,
flush themselves out. It's much easier.
no pounds are lost. It's not a diet.
Oh God,
Take a
wouldn't
peek.
that be scary if pounds were lost with all the snot that came out of your head? That would be a major problem. When is surgery indicated, and briefly, how's it performed? What's the general recovery time? How is the surgery done these days?
When we're talking about different things that cause inflammation in the nose, we try to treat it medically first. So if we can identify it as allergies with an allergy test, if you can't avoid the thing, take allergy meds, nasal sprays to get rid of the inflammation. And sometimes we have to take matters into our own hands and take the things that are swollen and shrink them down. So in that case, I'd say the most common thing that allergies cause, if you don't have chronic sinusitis and just have a stuffy nose, is called inflammation of the inferior turbinates. So your turbinates are these guys in your nose that kind of look like a grape on each side, and they get big and small and humidify air. And everyone has them, they do a job, and they're important, but if they get too big, then they can take up the limited spot of your nose. If we can't treat that with medicine, the next step is called a turbinate reduction, and that's something we often do in the office, where we take those grapes and a machine called a microdebrider, which is like a little liposuction to the grapes, and turn them to little raisins, push them to the side. So they can still get big and small and do their thing, but from a smaller starting point.
It amazes me how much stuff you can just do in the office these days.
Yeah, it's awesome. And if you can't make things smaller, you got to make the room bigger. So if you have tiny holes of your sinuses that drain all your sinus cavities, there's more stuff even in the office you can do, like a balloon sinuplasty. I don't know if you've heard of that. Or under local, you go into the actual natural hole of a sinus with literally a balloon on the end of a stick, blow up the balloon, deflate it, take it out. So the little hole, instead of being a few millimeters, is more like a centimeter, and everything can just flow. So it's either shrink stuff down or make stuff bigger.
My thought process of sinus surgery was that like it's this major thing, the recovery sucks, you have black eyes afterwards.
Yeah. Well, it definitely depends on the severity of your disease.
Sure.
I'd say back in the day, meaning more than 15 years ago when I've been doing this, there's these horror stories where people had black eyes. They had to get like a whole yarn ball pulled out of their nose, and it was the worst thing that ever happened to them. It's not like that anymore. Even in the more severe cases where we go to the operating room and rotor everything out, it's usually about an hour-long surgery. People go home. It's about a week. Like you feel like you got punched in the nose, but you have no bruising or anything like that. Take it easy. And then a week later, you come back, look in the nose, suction stuff out because you're going to have a bunch of bloody boogers. And then you feel better. So it's not the worst surgery in the world.